Hi everyone, it's Erick Iams. I am joining you today to have a discussion on reflexes. So normally the examination and eliciting of reflexes page is included in the level 2 seminar content, but I think it's so critical that you know this early on, because this can actually increase the results you're getting with the techniques. So let's jump in and study a little more. So I've included this page for you, which you'll see has a list of ways that you can increase reflex activity. So consider when you're just in a relaxed state, if someone tries to palpate, for example, your abdominals, it's going to be pretty easy to go through and palpate through the different barriers of the muscles. But if you're in a slightly contracted state, there's going to be much more influence in the nervous system. So let's talk about a couple things on this page here to begin with. DTR means Deep Tendon Reflexes. And the first one to try is the Jendrassik maneuver. You can have your patients perform this by interlocking their fingers and pulling their hands apart in front of their chest. Another way to increase reflexes would be to have your patient pushing their hands together in front of their chest. One of the things Dad used to love to do at the seminars was he would take a supplement bottle and glue the top to the bottle. It was empty, of course, but then he would give it to his patients and ask them to try to attempt to open the bottle. And that force of them trying to bear down and open the bottle would increase reflex activity. You can also instruct them to cough. Also try having them clench their fists. How about grasping the arm of a chair or the bed or table that they're on? Have them try clenching their teeth together. And the last one on the list is the positive Valsalva maneuver. So the way Dad used to teach the positive Valsalva maneuver was he would tell people to strain as if they're trying to have a BM. But the way he's incorporated it lately is that he will have someone just begin to tighten their abdominal muscles, so that as he's palpating into the abdominals, just begin to tighten. But you can still speak. I'm doing it right now. You can still talk and have just slight contraction of your abdominals. And that's kind of how he teaches the positive Valsalva maneuver to his patients now. Other suggestions that might help with your results: try to divert their attention, distract them. Ask them questions while you're performing the techniques. Maybe ask them to take a deep breath, count, read out loud, repeat verses to their favorite music, songs. What I witnessed from watching Dad treat thousands of patients over the years was that he would constantly work to distract them. So closing their eyes, making sure they don't see it coming, but also, especially on like repeat patients, if they knew what to expect, so they've already seen the technique or experienced it in the past, he would tap other areas. So if they were expecting him to be working on their shoulder, he would purposefully tap other areas of the body in order to distract them from what was coming. So give that a try, see if that helps. And finally, for an ideal response when eliciting reflexes, you want to time the tap with a slight contraction. You want the muscle at half length, and you're going to tap the tendon insertion. Well, I hope you enjoyed this brief video, and we'd love to hear your feedback. So do us a favor and leave us a comment in the discussion section to let us know if this was helpful. And if you're watching this on YouTube and you want some techniques to go along with these strategies, click the link below to check out our starter series, which is currently free for 30 days. All that's required is an email address. We don't ask you for a phone number and spam you with calls or any of that nonsense. So click the link below and check it out today.